Hi everyone, Bill Rentschler in the 1011 Now streaming studio. Thanks for staying up late with us. Appreciate it. I am joined tonight doing something really special, something we haven't really done before on 1011. We're going to be debuting a documentary tonight, and this documentary was put together by 1011's Bayley Bischof. Bayley, thank you so much for jumping in and joining us in the studio tonight. Again, I know we are up way past your bedtime.
Maybe not way past. It's just
Okay,
approaching.
just a little bit past your bedtime and mine. Again, the kids are usually in bed by 8 o'clock.
But it's well worth it.
Yeah. So you have put together a documentary. It's titled "Suffering in Silence." This goes into mental health issues here in Lincoln and kind of the surrounding area. It is a lengthy documentary. This is not something that we get to do on traditional newscast platforms. So before we jump into it and let everyone see it and we debut it, can you kind of give everyone just like a 10,000-foot view of kind of what we're about to watch?
Absolutely. So this was my best effort at kind of just capturing the state of what mental health needs and resources look like in Nebraska, including what are, some of the top concerns, who are some of the key players involved in helping people, as well as what things we're doing right or what things they're planning in the future that are doing right. You'll hear some really personal stories from family members who have been trying to get resources for their loved ones, and then on the other side of that, some people who have overcome and gotten resources and are now thriving no matter what mental health diagnoses that they might have going on.
All right, awesome. And so right now we are streaming live on 1011's platforms. Again, 1011now.com, 1011 app, all the streaming apps, Roku, Fire TV, Apple TV, wherever it might be. We're also streaming live right now on YouTube. If you have any questions while you're watching during this documentary, you can actually jump on YouTube and you can leave a couple questions if you have them, and we can try and answer some of those here at the very end. But you want to, again, grab your popcorn and kind of buckle up here. This is going to be about a 37-minute documentary. And let's go ahead and get it started here. Again, produced, written, and again, all done by 1011's Bayley Bischof.
Over the last several years, people from right here in Lincoln with nowhere else to turn have reached out to 1011 with a plea for help. Because in their search for mental health resources for themselves or their loved ones, they came up empty-handed.
We can't let incarceration be our new mental health.
You wonder every time you get a call, is this gonna be one of the times where he's dead? Somebody's calling to tell you that he's passed away, or he's in jail.
Now we're telling their stories and exploring what it's like on the front lines of Lincoln's response to the mental health crisis many in our community are facing. It's a patchwork system of resources and options with gaps that leave too many caught in the crosshairs of the justice system.
People need help, they don't need punished.
Our state prison system has become our largest psychiatric facility in the state, and that is not how things should be.
For each person pleading for help, there are undoubtedly many more in the community in need of mental health resources, without a voice, suffering in silence. Clay Anders is one of those people who reached out to 1011 in a last-ditch effort to share the struggles his family has been through trying to keep his brother stable and out of jail.
He can't go to certain group homes because when he's not med compliant, he's aggressive. And then being that he's been kicked out of so many apartments because when he gets not med compliant, he doesn't pay his rent, he doesn't take care of himself, so they kick him out.
Court documents show his brother has been diagnosed with schizophrenia. Clay has to provide round-the-clock care in between his full-time job as a truck driver, running a nonprofit for at-risk youth, and raising his own family.
It's impossible. Literally, you can't, because he is struggling, and you have to be there for him every day. And you have to be there for not just an hour, you have to be there an extended period of time. He has to be watched because now it's gotten so bad.
He says he's tried every resource he can think of, from nonprofits to police.
Did all the procedures I could, any place you call here in town that deals with mental illness, the first thing they say is if this is a mental health emergency, call 911. I did that over 6 times with no help.
Eventually, police did respond to one of his calls for help, but by then it was too late.
just to get a call from the county attorney a couple of days later saying, we got good news. He's in the county right now facing a terroristic threats charge, but he's safe. And in my mind, that's not good news. That's one of the worst things that could happen and what I was trying to avoid in the first place, because he's not going to get the essential resources that he needs there.
Clay's struggle to find support for his brother isn't unique. Another parent who reached out to us, who wants to remain anonymous to protect her son's identity, says she too has been fighting for her son, who has also been struggling.
Unfortunately, we had a lot of bad things happen in our lives. My close personal family, my children, which led to schizophrenia, bipolar diagnosis.
She tells us it's not fair he has to suffer.
It's just that his mental state is just not good. And it's sad and it's upsetting. Because he doesn't believe in himself. He doesn't believe in our family. He just feels like he's out there on his own.
Region 5 Systems Emergency Services Director Kristen Nelson says these two families are far from alone. She's constantly hearing from people begging for help for their loved ones.
Every single day. Every single day. And it's very sad because they are stuck.
Community partners in the area are plentiful and do their best. We spoke with a number of them to learn what trends they're seeing in the community, how they help, and what shortfalls they see in Lincoln's resources. We start with Centerpoint, which provides in- and outpatient mental health care.
Centerpoint started 50 years ago as a community response to the people who were struggling with substance use issues in the early 1970s, starting off as a substance use program to expanding into mental health and primary care and housing and other supportive services.
They helped more than 4,500 people access mental health or addiction services last year.
When people are experiencing that crisis, they can also walk in and have somebody to meet with in real time versus having to make an appointment or wait to get in, especially when there was a shortage of staff with the pandemic going on. And then we've always had the crisis line, so again, that other person that they can call in a time of crisis as well.
What's going on?
Centerpoint staff says the demand for their services have only grown year over year, but it's not necessarily the number of people struggling.
Today we're seeing more people with more severe symptoms.
Despite their best efforts, Centerpoint can't help them all.
So right now, only probably 20% of the population that actually needs help with mental health or substance issues gets the help.
The Mental Health Association is another nonprofit trying to reach those in Lincoln not getting mental health support. They use peer supports like Anike Jones, who shared her own experiences with mental health and addiction.
So drinking led me to basically give all the money I had to other people, to my addiction. I dabbled in drugs here and there, experienced being homeless in Omaha, living out of my car, and then even went to Arizona. Took off from everybody, and I experienced being homeless up there, incarceration, you name it, I did it. And so it just got to a point where I was just so tired of being sick and tired. And I figured something has to change, or this is going to kill me, which I had comfort in that, or this is going to put me back in jail.
Anike and her colleagues use life experiences like that to connect with people in need of services, share their stories, and encourage them toward recovery and treatment. They offer help in areas like employment, health insurance, group homes, support groups, and a crisis hotline. Above all else, they just want to be there for people who may need a little hope.
I know how that feels, and it's a horrible feeling. I've experienced that myself, and it sucks to be alone, but one thing about recovery is that you don't have to do it alone. Reach out. Google us on the internet. Type in Mental Health Association, and we have the main line. I will answer that phone and I will talk to you through it. I will refer you to our REAL program of peers that will come out to your doorstep and just sit with you and talk with you.
Another piece of this puzzle, the state's only mental health emergency room at Bryan West.
We see on average between 500 and 600 individuals a month that come through for mental health emergency assessment.
It would be really no different than if someone is experiencing a medical condition, so just like a heart attack or different things.
Bryan Health walked us through what patients can expect.
If you're here for suicide, anxiety, then you'll be escorted back to this area, which is the mental health area, where you would be taken back to an interview room.
Patients will talk with a social worker and may be admitted for a few days. The goal is for patients to leave the hospital with a plan for long-term support. But for some who need a higher level of care, that help isn't easily found.
Those beds on a state level are not available.
The lack of inpatient beds, both in the state hospital and in community treatment centers, was brought up time and time again in the more than 30 interviews 1011 did for this documentary. Described as one of the speed bumps on the road to treatment and recovery, holding people back. Lincoln police say they face the fallout firsthand.
Honestly, it impacts just about every call for service that we go on. And someone that's in crisis, someone that is considering or speaking of completing suicide, someone that has made an attempt at completing suicide.
Lincoln Police Captain Ben Kopsa says officers responded to more than 3,650 mental health calls for service in 2022. That's 10 per day.
So that puts it into a little bit of perspective on how many we're out on. And again, those are just calls that are specific to the mental health concern.
Police say they've had no choice but to increase mental health training for officers so they know what to do in these situations.
And our job is to respond, try to de-escalate, and problem solve with the individual who is out in the community to try to get them in touch with whatever resources may be most appropriate for them in that particular moment.
Not something that we're trained to a therapist level, but it is something that our officers are very skilled at.
Some of their options include calling in a partner with a nonprofit like Centerpoint for evaluation, referring the person to a peer support or resources like those at the Mental Health Association. Or if the person is mentally ill and imminently dangerous, they can take the person into emergency protective custody and take them to the crisis center, headed up by Scott Etherton.
If someone threatens suicide and needs to be, and the law enforcement or someone doesn't believe that they're safe on their own, they can be placed on a hold in which an evaluation has to take place for that individual.
Two parents of Lincoln men say within the last few years, they've called police hoping for their adult children to be taken to the crisis center during mental health emergencies. But instead of help, their loved ones were let go by police, only to later end up in handcuffs. For Brenda, it also left her in the hospital.
The only thing I really remember at all is seeing Austin running towards me and yelling like he was scared to none other, that yelling, "I'm not going to let you let them kill me." And I wound up in the hospital. I don't remember how I got there.
Brenda says her son has been diagnosed with a severe mental health condition and had recently been kicked out of a long-term treatment center, discharged from receiving developmental disability services from the state, and was on a new psychiatric medication. In the days leading up to the assault, he had been struggling.
Austin's behaviors were very out of character for him. He was very focused on thinking that I was a vampire, that I was feeding him human meat, that I was, you know, not who I said I was, and he was very fixated on me, which is very odd.
Having previously been placed in emergency protective custody, Austin was involved with the mental health board and law enforcement. Brenda tells 1011 she kept asking them for help.
Begged him, please place Austin in emergency protective custody. You have to. And he then, you know, told me he could write an affidavit and send it in to the county attorney, but he knew that the county attorney wouldn't sign it.
Her son didn't get placed in emergency protective custody. Instead, he landed in prison with an 18-year sentence after the assault. The officer Brenda begged for help, apologizing for not being able to do more.
He could have done something. He could have done something.
Chris Kristen's story is similar. He says his son was in a mental health crisis and threatening to take his own life when he stole a car and threatened the driver. Just before that happened, Chris, a former Nebraska state trooper, was on the phone with police begging for his son to be taken to the crisis center.
And I said, oh, for the love of God, please, please, EPC him. I go, there's a history of this, you know, he spirals down, things are going to go bad. You know, I'm really, really worried about this. He goes, well, we'll evaluate him, and he's safe right now. And in the end, they decided not to. They said he didn't meet criteria.
It wasn't long before his son was arrested and behind bars.
There was a way to prevent this from happening. And I feel for the victims. You know, when we talk about systemic issues in our society, and I think this is one that we just kind of push off mental illness to the side. And it doesn't have to be that way. You know, we can actually help these people.
Because of the concerns brought up by Brenda May and Chris, 1011 looked into the process for getting someone placed in emergency protective custody. The process, laid out in state law, requires the person to be mentally ill and dangerous.
Well, the procedure is designed to protect the person's liberty interest. Everyone has the right to liberty, and to force them into treatment, you're interfering with their liberty. Even if it's an outpatient basis, you're making them do something that they might not want to do. So the procedure is designed to ensure that there is clear and convincing evidence that the person is dangerous.
But LPD said they don't always get it right.
We're making a difficult decision, and again, it comes down to a point in time, the immediacy of the concerns. The person has to be an imminent threat of bodily harm to themselves or others, and so there's always going to be negative outcomes when we're leaving people in the community that I wish that we could always make the right decision, but sometimes the hindsight is 20/20.
Now, Brenda and Kyle's sons are in the criminal justice system, where we've been told mental health resources are not readily available. Not in the Lancaster County Jail.
It's extremely frustrating for us to be the last resort in a lot of regards for that population. We are not equipped with the appropriate infrastructure to treat them in the best possible manner.
Nor the Department of Corrections, who declined an interview with us. We did talk with Doug Kobernick, who provides oversight as Inspector General for NDCS.
Well, the number of people that have a mental health condition of some sort or another is quite high within the correction system here in Nebraska.
The Lancaster County Jail does have a behavioral health unit, and anyone entering NDCS gets a behavioral health assessment, and people with severe mental health needs receive therapy at least monthly. But those limited options aren't always enough.
There's a number of people that have come across where you think, well, if they just had a treatment-oriented facility in bed that they could be in and that you would see this positive change. And as much as the Department of Corrections and their mental health team tries to help somebody, it's a much different environment. It's not a therapeutic treatment environment, really.
Nebraska's criminal justice system, particularly those involved in probation, told me in a panel they are hyper aware of the need for more mental health care.
Upwards toward 80% or more of the individuals who come before the courts have some kind of behavioral health problem, whether it be with substances or just mental health as well. And so a large percentage of people have those problems coming in, which may be directly related to the charges in which they've been arrested for, or may be a compounding issue that helps, or I should say impedes them getting the help that they need.
They echoed the concern that people's mental health needs are only getting more extreme, forcing a greater focus on getting people help and resources, not just punishment.
What we've learned is we can't ignore mental health and have our communities be safe. We know that it is essential that mental health is a core piece of community safety.
Part of probation's job is to connect people with resources like inpatient or outpatient therapy, medication management, and more, both on entry and release from the justice system. A lot of time they're able to do that, but not always.
First and foremost would be the waiting list. If people can't access the services that they need right away, you're obviously postponing addressing those issues or behaviors that's kind of causing or attributing to the criminal behavior. Also, as we said, that's like saying you're sick and medicine's not available.
This brings us back to one of Nebraska's biggest roadblocks to treatment for those who need it most: the number of beds in inpatient treatment centers, namely the Lincoln Regional Center.
I'm currently allotted under what they call the bed allotment, about 17 beds.
Kristen Nelson says the state went through a huge adjustment of mental health resources in 2004 when LB 1083 went into effect. It closed 2 of the state's 3 regional centers with the goal of getting people with mental illnesses out of institutions and into their communities.
I would say LB 1083 was a very big success until.
Kristen says inpatient beds are far from the only solution and only a fit for 1% of the people Region 5 touches. But for that 1%, it's critical.
I have one female right now at the Mental Health Crisis Center who's been waiting over 100 days in a crisis center. That's just a good example of a system failure. That is not where we should be. People should not be sitting in a facility like that for 100 days.
When LB 1083 first passed nearly 20 years ago, Kristen says there were 100 beds available for commitment at the Lincoln Regional Center.
And then it was 90, then it was, I think we're currently at 40. So 40 is not enough beds statewide, which is why I think we're seeing some of the pushback and the kickbacks in the system.
Another one of those clogs in the system relates to a different group of people in need of mental health treatment, those deemed not competent to stand trial, waiting in jails for treatment so their case can move forward. The director of the Lancaster County Jail says the wait is often more than 100 days.
102 days is still an unreasonable number for folks to essentially be in limbo within the justice system.
Yeah, I mean, it's not good, I guess, is the general consensus. It's not good. At the jail, people who are actively experiencing symptoms of their illness, who are not able to be in groups with other people, are there in a cell by themselves.
Quenton Runner, who lives in Sarpy County, lived that experience.
Yeah, that bothered me. Yeah, because like, I don't know, I just didn't really, I didn't want to wait at all. I just wanted it to be done with.
He sat in the county jail for months, waiting on a bed at the regional center after he was arrested for assaulting his mom during a mental health crisis.
It was just a rough day, and he tried to push me down the stairs, and I had to have a coworker call 911 because I couldn't get it done. And they took him to jail for me that day.
Melissa called police because she was out of options to get Quenton help.
It was like my last resort.
And then, when that help didn't come for Quenton for months as he sat in jail, she said she wouldn't give up.
I think it's awful. I mean, I don't understand why we're making prisons larger, jails and prisons larger. I don't understand why we're making more jails or prisons when we should be making more hospitals to treat for mental health.
After several months and a lawsuit, Quenton got a bed at the regional center, and he said it actually helped.
Because I just met more people that were positive about it and just trying to make me be better.
Quenton is now back living with his mom, spends a lot of time watching movies and sports, and works 2 jobs.
I'm a cook and a server at a catering business. Like a cook at Freddy's. I mean, I don't really care who knows. Like, I love the job though.
The two do a lot together, from sand volleyball to working out. But Melissa says it took that rock-bottom call to the police and begging for help from attorneys and judges to get here.
I think I would have had to kick him out of my house and he would be living on the streets or with some strangers or doing drugs or something to try to subside whatever he was feeling.
While Quenton is back to living his life, so many are waiting for help. 1011 has requested an interview with the Nebraska Department of Health and Human Services about the regional center's staffing, bed counts, and allocations for months, but they declined. The DHHS online dashboard showed as of the second week of January of 2024, the regional center had 224 total staffed beds. 41 beds for patients whose care in the state hospital is necessary to protect public health and safety. 55 for people found incompetent to stand trial, 85 for people sentenced under the Mental Health Board Commitment and Sex Offender Registry Act, and 16 for people who are, quote, equally meritorious who are indigent. In an email, DHHS did tell us that breakdown is determined by state law, and that they do have additional open beds, but not enough staff to support them. This is a problem for mental health facilities across the state and the country.
In short, there's not enough people going into behavioral health careers.
The Behavioral Health Education Center at the University of Nebraska Medicine, headed up by Dr. Marley Doyle, says that's for several reasons: awareness, financial barriers, and retention.
So you have kind of this perfect storm of an increased need for services and a stagnant workforce, or even a decreased workforce, because we also did see some people leave the workforce during the pandemic.
As of mid-2023, when the Inspector General's annual report came out, NDCS didn't have any psychiatrists on staff. They were short 11 psychologists, 4 social workers, and 40 behavioral health practitioners.
They're really, really stretched thin because of all those vacancies. So I've had a lot of people on the inside staff that express their concern about not being able to do that treatment side of things as much as they want to, which is concerning for me.
This shortage touches every aspect of mental health care.
We have a lot of med management, but we don't have enough to meet the demand. So there's an extensive wait list for med management right now. It's not that it's not available, it's that there's a significant wait.
Some of the challenges that officers experience on a day-to-day basis are capacity issues within the system.
And people in these populations can't always wait on a list for help.
When we're concerned about an individual with behavioral health concerns and they don't have access to services is where things get problematic and maybe their symptoms increase.
And when those symptoms increase, it can put people right back to where they started, a mental health crisis with nowhere to turn.
Some of these patients with mental illnesses do not have medicine and do not get the medical care that they're getting. I mean, we'd have more crime or more assaults or more homeless on the streets.
More suffering, more victims. As research shows, people who have mental health diagnoses are much more likely to be victims of crime than perpetrators. State Senator John Frederickson says he sees this cycle happening in Nebraska.
One of the biggest reasons I decided to run was that I was seeing over and over again ways that the lack of mental health infrastructure was impacting Nebraskans' day-to-day lives.
He and colleagues have held a number of interim studies looking at aspects of Nebraska's mental health response, including examining the number of beds needed at the regional center and what other resources could be added in the state.
Anyone who has boots on the ground is aware that we're in a mental health crisis.
While there is much more work to be done and many still in crisis, there are already solutions making a difference on the staffing front.
We have had success at Beacon, and we've seen an increase in the behavioral health workforce, which was very unique compared to the rest of the country. So most states are seeing the workforce be stagnant or decrease even. And so Nebraska is unique in that way, and we are one of the only states that has a workforce development center. So to me, what this proves is that if you have intentionality in addressing workforce shortages, you can make a difference.
Beacon has created programs to help behavioral health students pay for school, combat the burnout that hurts retention rates within the field, and create job opportunities in areas of the most need, like placing student interns in county jails and the regional center.
To date, we've had 104 students go through the program. And the impressive thing about it is that about 25% of those students actually took a job in the corrections setting. So that just goes to show that programs like this do work.
Taking it one step further, the University of Nebraska Medical Center is also creating a fellowship for forensic psychiatry.
We as forensic psychiatrists work a lot with people who are involved in the criminal justice system. People who have either offended and are in jail or prison, or who are facing charges. And we also work on the civil side of things as well. So we do a lot at the intersection of psychiatry and the law.
By this spring, the program's first fellow will be working in the Sarpy County Jail and traveling to other corrections facilities to do psychiatric evaluations.
The goal really is to get people those services and treatment when they're just initially entering into the justice system, when those offenses are still at the really low level, before we see things escalating.
There's also a new voluntary crisis response center in the works in Lancaster County that will fill this vacant veterinarian's office in Northwest Lincoln.
What that would look like would be a walk-in. Hey, you're having a really bad day. Could I take you here? Maybe somebody to talk to. You could talk to a peer, a therapist, a case manager, a nurse, and really kind of problem solve. The crisis stabilization part is about 3 to 5 days in the VCRC. And then we are also offering a respite on the backside. What that would mean is if somebody, if somebody was wanting more care, more time, needing more time, they could stay up to 28 days and respite.
Law enforcement also working to take a less punitive approach. They've added mental health officers over the years, and Officer Melissa Ripley, whose sole focus is helping those who are unhoused, who often struggle with mental health or addiction, and end up with a lot of contact with police.
If we continuously put people in jail in there, it's just a revolving door in the criminal justice system. It really doesn't address the bigger picture of how do we solve this problem long term. We're never going to arrest our way out of homelessness.
In addition, at times, police are also having mental health experts respond alongside or in lieu of police for mental health calls for people who are unsheltered.
It will reduce the amount of contacts that people have with law enforcement, and thus reducing criminal justice involvement.
And community-wide, there are success stories. People who have navigated the system to access mental health resources and are now giving back, like Melissa Lemmer.
I have had experiences of mental health issues since my early adolescence, and I spend a lot of time in and out of hospitals and institutions. My life looks very different now.
She's been working with the Mental Health Association for 16 years, using her life experiences to help others.
Trying to access services was really difficult. It still can be. Financial barriers have been significant in my life, especially when it comes to medication, and finding providers that take the insurance that I have.
Her job now is to help people navigate their employment and health insurance to help them on their path to recovery. It's a full circle moment for her.
A lot of providers had really low expectations of me because of my diagnosis, and they thought that I would never be able to work, that I would be on disability the rest of my life, that I wouldn't be able to get married, that I wouldn't be able to do the things that I had goals and dreams and hopes of. And when I was introduced to RAP and MHA, I was introduced to words like hope and recovery. I'm a homeowner, I'm married, I work full time, I'm a pet parent, I have a lot of things, I have a lot of hopes and dreams and things that I live for now that I didn't used to live for.
Ladonna Little Elk's been there too.
I struggled with alcoholism, and my family wasn't sure how to get help for me.
Until she got in touch with the Mental Health Association.
Met with a peer and, just talked and connected that way. And then once I did get sober, completed treatment, and they asked me to volunteer, and I've been here ever since.
She's now helping others work through their struggles at one of the Mental Health Association's group homes, hoping to give them the same hope she got from her peer.
She gave me the option of, well, do you even know what you want? And that was just, it gave me like a little glimmer of hope of, wow, so other people have done it. This person sitting in front of me has done it, and she has a number of years sober. So I just walked away from that conversation with a little bit of hope, and that's kind of what drove me to finally get into treatment.
Melissa and Ladonna say the frustration parents, siblings, friends of those struggling may feel is real, but you can't force recovery on someone.
And so I've always been a love them through it type of approach, because, when you're dealing with something like that, it seems like the world's already given up on you, or at least that's how you feel. So to have someone in your corner means a lot.
I think it's huge.
Those we interviewed say these successes should be celebrated, but the community needs more. More inpatient beds, both involuntary in the regional center, but voluntary options too. More affordable access to therapy, medication, housing, support systems, and community involvement.
People can live a great life, a life beyond their wildest dreams, and I think everyone deserves that.
Community partners 1011 spoke with say this will take money.
Funding behavioral health is a priority. There's lots of priorities in the country and Nebraska, but I think behavioral health really affects all of us.
Because this is a community health issue. At the end of the day, it's not something that's going to go away, and we are just one small piece of that puzzle.
Senator Frederickson says he's going into the 2024 legislative session hopeful.
We can either pretend like this is not an issue and we can pretend like this is not happening, but I don't think that's going to be the case.
Multiple people involved in Lincoln's mental health response say with more resources available on the front end, there will be more people like Quenton, Melissa, Anike, Ladonna, people who are overcoming and thriving. People whose mental health is just a piece of their story.
For a long time, I lived my diagnosis. I thought that's all I was. And when I found that I could live in the community just like anybody else, like I have 2 dogs and a cat, and I love makeup and things like that. So I love things that other people love. And it's not who I am.
And fewer people like Clay, Brenda, Chris's loved ones behind bars or in a prison of their own mental illness, suffering in silence.
It's just a system that is broken and it's not working, and we need to do more. We need to put a microscope under what we're really doing instead of just putting a Band-Aid over it and calling it good.
The stakes too high not to act, and soon.
Not just treating the person and ensuring that Nebraskans can thrive and be healthy, but thinking about the families and their communities and, frankly, the economic impact that this has on our state. So this is a really big concern. It should be a huge priority in our state.
All right, welcome back, everyone. Again, that was Suffering in Silence, a documentary put together, again, entirely by Bayley Bischof. Again, she did have some help that we'll have some shout-outs for later. But, Bayley, we did have a couple questions here on the YouTube stream I want to try and get to. The first one, what do legal guardians of an adult child do when the police do not honor the court-appointed guardianship?
This is a question I don't know if I have a good answer for, but there's so much we touched in here, and there's so much more we can keep reporting on, so that's something that I can look into.
And that's something we were going to talk about in a second, but you were going to have even more reporting on this topic.
Yeah, that's the goal, yeah.
All right, the next one was, says, my question is, when you put somebody into protective custody, when they go to the crisis center, how long do they have to stay there before they are deemed that inpatient is the option?
Well, not every person who goes to the crisis center is going to be told that inpatient is their option. They do have to be there. They have to have an evaluation by mental health professionals, and they have to go before the mental health board within just a couple of days of being there. And then once they go before the mental health board, that board is made up of all different kinds of community members. We heard from the chair, Sean Brennan, but there's also, mental health professionals. There's an attorney. There's a whole number of people who are on that board. And they decide what is the best route, whether that's inpatient, whether it's like medication management, outpatient therapy, those different types of things. But I believe it's a few days before that decision has to be made, just to respect people's time and not keep people there unnecessarily.
But it's not a quick decision. There's a process that kind of goes into that.
It's just a couple of days.
Okay. Next one, or again a comment that someone said about the opening up the psychiatric hospitals they closed down. What about the one in Norfolk?
The Norfolk Regional Center is technically open, but it's only for sex offenders, so it doesn't provide bed space or treatment for a lot of the people who are waiting, like people who are in jails waiting for competency restoration, or people in crisis centers who need that higher level of inpatient care. So that does exist still. It's just not being used for wider mental health needs. Still serving an important function for sex offenders, though.
So the Lincoln Hospital is the only one then?
Yes.
For the entire state?
Yes, and the one in Hastings has been repurposed into a youth treatment center.
Okay. And then there's another comment here that says resources for juveniles have long been at the breaking point, specifically crisis respite beds and residential treatment centers.
Yeah, that's something that I heard quite a bit throughout this process of reporting. That was a topic that exists. It's so different. The resources and all the structure is pretty different for youth compared to adults. So we didn't get into it in this piece, but I do have one interview already done with the mom of a teen who's been struggling. So I do plan on doing some more reporting just about the specific youth mental health crisis down the line.
Mm-hmm. And then there's another comment here that just says, thank you for spotlighting the problem so much that needs to happen. And that's one of the first things I wanted to say as we came back here is just kudos to you, Bayley, again, for doing a tremendous job on a topic that is not easy to cover, and it's not easy. I'm assuming it's not easy for a lot of people to talk about this issue because it is extremely personal, and I think you did a really, really wonderful job. But again, some of the questions I had that I wanted to ask you, again, going through this and watching this, where did this come from? Where did you get this idea to put this piece together?
I've done a lot of coverage over I've been reporting in Lincoln for almost 7 years, and I've done a lot of coverage on the criminal justice system, and in doing those stories, you hear about people who are there because of mental health involvement or just different mental health needs, and I did a couple of stories that kind of really got me interested in. One was initially, you heard from Melissa and Quenton Runner.
Mm-hmm.
I learned about the wait times at the jails to get into the regional center and did a special story there.
Mm-hmm.
And then I wanted to do a follow-up on that to see how things were. That was a couple of years ago. I wanted to see how things have changed, and it just kind of bloomed into this whole what else could change, or what else are the issues. And our new director of news and innovation suggested, instead of a series, why not make a documentary? And so I just never done anything like this before, just gave it our best shot.
Oh, and again, in our medium, in TV news, again, a lot of times it's a day turn, and topics that we would really like to dive into more deeply. But again, sometimes it's just a matter of time and resources. How long did it take you to put this together?
Yeah, so I think I did an interview with Melissa and Quenton back in June that I ended up redoing now because it morphed into this documentary. But after that interview was really when I was like, okay, we're going to do something.
Mhm.
And so throughout the summer into the fall, my last interview was January 5th, one I had to redo. So really over the last 6 months, I did interviews, and then starting in like October is when I really knew we needed to get to work. So in October, I made an outline of kind of how I wanted things to fit together. In November, I started writing the script. By Thanksgiving, we had the script, and then it's just been editing ever since.
And we've seen you hard at work doing it whilst trying to do everything else here in the newsroom. So again, a very long process, but again, a very well done process.
And it wouldn't have been possible without all the people that were willing to share their stories and talk with me.
Yeah, and again, that was my next question. Is I know you mentioned in the story there were some places that declined interviews, but for the most part, it sounded like everyone was very willing and open to have a conversation.
Yeah, the only no's I got were from NDCS, the Department of Corrections, and DHHS, and even DHHS, they replied, like both gave me some information in an email. They just wouldn't sit down for an interview. But other than those two, I don't think I got a single no. Everyone was really willing to share what their experiences were like, what they do in their jobs, what their stories are, and I think that's really hopeful because people want to talk about this. They know it's a priority, and they might not have all the answers, and we don't have all the answers, but people care and they want to talk about it, which is really amazing.
And we only have a couple minutes left before we have to jump off here before the 10 o'clock news starts. And there was been a few more questions that have rolled in. And I don't necessarily want to put you on the spot because, again, I know you don't know everything necessarily about this. You know most of it,
I think
but
as
not
long as we
everything.
know I don't know everything, I'm happy to,
We can take a crack
hear
at
the
it.
questions, absolutely.
All right, so again, a couple more that have come in. It says, what about when we call police for help and then go to the county attorney for help and he declines our affidavit?
I think, is that from Clay?
It is.
Yeah, he's been in an impossible situation, a really difficult situation, and I think not having an answer to that is how he ended up here, like reaching out to us in that last ditch effort. It's, I mean, a good question to pose to the county officials, to different people involved to see maybe what their answers are for that. I'm sorry, I don't have a better one.
And again, Clay has a couple other ones here. What about when the person is their own guardian and you try and EPC them and they know better than to say they're suicidal and police refuse to take them?
That's a really hard dynamic that I think even covering this story kind of wrestled with, because you never want to take away someone's autonomy or their ability to make decisions for themselves, and it should be a high bar for taking someone's civil rights away and putting them in emergency protective custody. So many of the people I interviewed have that struggle of they have adult loved ones that they're trying to take care of, and the adult loved ones unfortunately are not in a place yet where they want to take care of themselves or want to move forward. I think the advice that was most helpful from the Mental Health Association was to just keep being there for them as much as you can and keep trying, and then hopefully one of those times the treatment or the help will stick. That's not a perfect answer, but I think you see the success stories like Melissa and Ladonna and Anike. They said that it was a long time coming, them getting on that path forward to where they are now, but they just people had to keep supporting them and to keep offering them the resources. And of course the resources have to be there when they're ready, but I think you can't give up on people, and you have to give them a little grace too.
Yeah, I think you hit it on the head there at the very end. You just can't give up on people. And again, we only have a few minutes left here, but again, I really wanted to ask, so again, you talked with State Senator John Frederickson, some changes need to be made here and there. What's next? Like, what's on the horizon? The legislative session just started here a couple days ago. The governor just gave his state of the state. I think it was earlier today. So again, those things are getting in full swing here. So what can we maybe expect to see? Maybe this legislative session or coming up here.
There's been a couple of bills introduced newly this session. I have notes on this, so I'm going to look down just to make sure I'm right. Senator Frederickson, who we interviewed, has introduced a handful of different bills related to mental health. One is to create a mental health director for the Department of Corrections, which we know there's a huge mental health need there. Another is to use some federal funding to address the lack of access to mental health resources in rural Nebraska, which is a huge issue that we didn't have time to get into today. Senator Myron Dorn introduced a bill to increase funding for more behavioral health resources, and there's also some bills that are a carryover from last session. Senator Michaela Cavanaugh introduced last session a bill that would direct some sales taxes to provide mental health services. Senator Justin Wayne introduced a bill that would require corrections employees to do mental health training to look out for their own mental well-being, which is important. That's a tough job. And then there's a bill that would two more from Justin Wayne that would allow mental health practitioners to take people into emergency protective custody. So if a psychiatrist said that they need to go to the crisis center, then that would be an option, not just police. Another one is to add a person with mental health experience to the pardons board for people who are, applying for pardon from their criminal sentences.
Yeah.
So yesterday was the last day to introduce a new bill. So far, now they'll go into public hearings. None of these ones I mentioned, and there are others related to mental health, have been listed as priority bills. But we still have a few weeks, actually almost a month until then. So there's hope.
There is hope. And again, hopefully, doing something like this.
Call your representatives if
Call
this
your
is something you
representative,
care about,
absolutely.
and let them know.
And hopefully we see a couple of those become priority bills so that we can see those get pushed through. Again, the system's not perfect. Could use, like I said, some changes here and there. For people at home, who might be watching this, for themselves, for their friends, for their family members who might be struggling with mental illness. Because, again, there is the stigma out there. Some people just don't want to talk about it. They don't want to admit to it. If they see, your piece, and they want to maybe get the ball started, what would be the place for them to go? What resources should they seek out?
I think there are a lot of good resources in Lincoln, and I'm not going to be able to name them all here. I think starting at those nonprofits that we worked with are really great options. Centerpoint does so much for mental health resources. They have the crisis line, of course, and they also have therapy they can provide. And then the Mental Health Association, you heard Anike say to call her.
She will talk on the phone with you.
She will talk to you.
They will send someone to your house just to sit with you.
Yes. I think that is an amazing resource, and I would want to, if I was having a problem, I would want to call someone like Anike to share it. And over the next week, I'm going to we'll put in some of those mental health resources, some of those phone numbers, on the 1011 website so that they exist there. But also, just if you look up Mental Health Association or Centerpoint online, you will find those resources.
And you just mentioned it, but this is not the last time you'll hear from Bayley on this issue. Moving forward over the next several weeks, you're going to take basically what we just watched, and we're going to kind of break it down into more TV format. So you will see stories on this generally in the 10 o'clock newscast, I believe.
Starting the January 29th that week, and then the following week we'll have it broken down into, probably 2 or 3 minute stories.
Mm-hmm. More easily digestible on a television format. Bayley, thanks so much for jumping on. I want to read 2 last comments.
Yeah.
Again, one was from Brenda, who we heard from in your documentary. She says, "Thank you so much for being the voice for us and our loved ones." And Clay said, "She is a blessing for covering this, so I do praise her for standing up and shedding light."
Well,
Thank you.
That is very, very nice of them. I could not have done this without people like them being willing to talk with me, and also people like them just taking the chance to send an email to share their stories. And I would not have been able to get here without people willing to share their stories. Also want to shout out everyone who helped along the way. My news director Michael, who reread scripts a billion times. Ellis Wiltsey, who former 1011 extraordinaire, who helped shoot some of the interviews. Everyone here who pitched in, read scripts, watched video. Bill, who helped put this whole night together. I did a lot of it alone, but by no means could I have done it all alone.
It takes a village. All right. Again, Bailey, thank you so much again for putting this together, for staying up past your bedtime to sit here and, again, answer some questions and to go through this. Appreciate it so much. Again, we have the 10 o'clock news coming up here in just a couple minutes, so we will, again, go ahead and leave it at this. The full documentary, again, if you want to watch it, it's online on 1011now.com. You can get it on all of our streaming platforms as well as our YouTube channel as well. Again, so you can see it again in full. If you want to share it, please do. Again, if you see it on YouTube, please give it a like. We always appreciate that. So, again, appreciate everyone for tuning in and for watching us tonight. Again, 1011 News at 10 coming up here in just a couple minutes. So, again, keep it tuned to 1011 for all the latest news, weather, and sports. Appreciate everyone for tuning in and watching. Hope everyone has a nice night.